Welcome to Herbally Yours, an adventure into the world of natural medicine. Here is your host, Dr. Ellen Kamai, the natural nurse who will help you take the leap to ultimate wellness.
And greetings. Thank you so much for joining me, Ellen Kamai, the natural nurse, for another edition of Herbally Yours, right here on the voice of Nassau Community College, 90.3 WHPC. Herbally Yours brings you the latest information about the many facets in the world of natural living. Today, we are so happy to have as our guest Dr. Concussion Rescue. He is a naturopathic physician and author of the book Concussion Rescue, Integrative Therapies for Head Injuries, Dementia, PTSD, and Anxiety Disorder. Dr. Concussion Rescue has been staff physician at Amen Clinics since 2013 and works in the Seattle area. As a graduate of Bastyr University, he is an expert in the use of functional and integrative treatment and collaborates extensively with many of the Amen Clinic physicians. He has a special interest in the assessment and treatment of Alzheimer's and dementia, traumatic brain injuries, PTSD, and anxiety. He has additional training in the assessment and utilization of hormones to treat traumatic brain injuries in combination with SPECT imaging and the Amen method. Dr. Chapek is the founding president of the Psychiatric Association of Naturopathic Physicians, which is an affiliate group of the American Association of Naturopathic Physicians. For more information, you can find Dr. Chapek at the website for Dr. Amen, amenclinics.com. Thank you so much for joining us today.
I'm delighted to be here. Thanks, Ellen.
So let me let you know, first of all, since we have never met, that we've had many naturopaths on this show because this show features natural medicine. It's called Herbally Yours for that reason, and I know you are fully trained in herbal medicine. And my business partner for 40 years is Dr. Eugene Zamperone, who's a graduate of Bastyr, and my daughter-in-law is a graduate of Bastyr, and I myself have taught at Bastyr, so I'm very familiar with the excellent training that you have received. What made you decide beyond naturopathic college to specialize in neurology?
Well, Ellen, it's a great question. I'm so happy to be here amongst my fellow natural health advocate. I love natural medicine, and I just fell into it. I think it's that when I was growing up, I wanted to feel better. I wanted to feel good. I wanted my family to feel good. And I felt my best when I ate well, when I took nutrients that fueled my body and my brain. And then I found myself working at an eating disorder facility that I was also treating depression, anxiety. And I was doing the same thing, helping people feel well by using natural treatments.
So you've really focused on it as a specialty.
I did. And I found that the brain is fascinating to me. The brain has more connections than there are stars in the universe. And it uses 20 to 30% of the calories in our diet, our hungry brain. And so that made sense to me when I was studying nutrition and why I noticed patients felt better if they ate a healthy diet, for example.
Well, I know one thing that's very controversial is that, of course, when we look at the physiology of the brain, and I'd love for you to share that with us, it really is kind of a lump of fat. And what happens when people are overprescribed all these cholesterol-lowering medications?
Oh, my goodness. Yes, the brain is 70 to 80% fat by dry weight. And so we are fat heads. I mean, our brains love fat and they love cholesterol. In fact, the Framingham Heart Study that told us that there's some heart disease risk factors associated with high cholesterol. The folks that had the highest cholesterol levels were also had some of the highest intelligence and brain function. So we don't want to sacrifice the the brain for the heart by trying to lower cholesterol too low, and we found that some of the statin medications, which lower cholesterol, are damaging to the brain as far as increasing problems for memory. Some people will start on statins and start to have memory and cognitive problems. And I think that's wise, because the brain actually needs the fat and the cholesterol. Cholesterol also is needed for making hormones. All of our hormones are made from cholesterol. They're a building block for them. And we need hormones for growth and development, energy, to feel good.
Well, I agree with you, and I think there's a vast overemphasis on just bringing down that number in conventional medicine, rather than looking at overall health. Another interesting study, I never heard of the one you mentioned in terms of people of higher intelligence having high cholesterol, but I do know that the healthiest people in older age, in the geriatric category, 80s and 90s, are those who do not treat any kind of cholesterol, and they're the well people who are in their 80s and 90s and running around playing tennis and dancing, like my parents, for instance. They have a slightly elevated cholesterol level. They're both in their 90s, and they just ignore any kind of prescriptions for statins, and they're running around. But studies have shown that is the population that is.
We've got it wrong. No, that's awesome to hear. I'm glad they're so healthy and youthful.
Well, I think it has to do with they kind of eat very little, only healthy stuff, and their butt doesn't touch the chair the whole day, And they're married. We're having their 70th anniversary celebration, and they fight all the time. I don't know. I guess they like it, So you really have to look at success.
Good for them. Congratulations.
Oh, thank you. So I want to remind our listeners that you are listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. I'm Ellen Kamai, the natural nurse, and today my guest is Dr. Kabran Chapek, and he is the author of Concussion Rescue, Integrative Therapies for Head Injuries, Dementia, PTSD, and Anxiety Disorders. And thank you so much for being our guest. You created something called First Aid for Your Brain. What is that? And I guess you're talking about when there is a head injury. What are those steps?
A lot of the research on brain injury, acute brain injury, is on acute brain injury. So patients that have just had a severe car accident or fall are taken to the hospital, and we're trying to save lives. And most of it, large-scale trials have failed to find the one thing that will cure brain injury, will treat brain injury. We've really failed to do that. Now, this is not to knock the neurosurgeons and their teams, which have done an amazing job at bringing down the death rate from 40 to 50% from severe brain injury down to 20 to 30%. So that's nothing. That's excellent. We don't want to minimize that. However, we're not doing enough. There's people suffering every day from chronic brain injuries, and what we found is that there's hundreds and hundreds of studies showing that specific targeted nutrients can decrease the inflammation that happens when you have a concussion or a head injury. Now, and this is not just sports. This can be car accidents, a fall. In fact, falls are the most common cause of concussion and head injury, and most common in the younger adults, or children actually, and older adults above 65, falls, and it's the number one cause of head injury. And just like we have rest, ice, compression, elevation for a twisted ankle, I would like for people to take these nutrients that quench inflammation, because we know that there is inflammation, there's swelling and damage that happens immediately after a hit to the head. It's just that we can't see it. And so I recommend that people, just like rice for a twisted ankle, do something immediately to facilitate healing. And people will go to the hospital and get a CT scan and rule out the worst case scenario, rule out a brain bleed, definitely do that. I'm not recommending not to do that. I'm recommending to do the standard concussion protocol, but in addition, we want to facilitate healing.
So how is that done? What is it? What is the action steps that would be good to know?
Yes, and so I've taken the best of the research and put these nutrients together. The first one is called NAC, and I'm sure you've heard of NAC, N-acetylcysteine, which is, and if you take as a supplement, it turns into glutathione in the body and the brain. There's a fascinating study done by Theodore Roth. He was actually an undergraduate student at Stanford at the time. This was in 2013. And he implanted an intracranial microscope into the mouse skull. And then he took these poor little mice and he gave them a head injury. And we were able to see never before seen footage of a real-time concussion in the making. And we're able to see that the resident macrophages, which are like immune cells in the brain, became very, they produced lots of inflammatory cytokines, reactive oxygen species, sort of like inflammation, oxidative damage in the brain, like rust, like a car that rusts in the rain and can rust from the inside out. This is happening in the brain after injury. And then he took glutathione, which is the body's premier antioxidant, and applied it to the mouse skull, and found that if applied immediately, within 1 to 3 hours, there was 67% less cell death. And if applied after 3 hours, but within 6 to 12 hours, there was 50% less cell death. And so we know there's a window of time in which to act. And that's why it's important to take these nutrients immediately. So I wish at the sidelines, football games, and people would carry with them in the first aid kit these nutrients. So N-acetylcysteine for glutathione.
Okay.
Simple vitamin C. Vitamin C, great antioxidant, doesn't get enough respect, really is helpful at lowering inflammation in the brain and the body. So 1,000 milligrams of vitamin C, 4 grams, I recommend taking 4 grams of NAC, and part of the reason of that dose of NAC is that another study I'll tell you about, which they did a military study. They took 81 active military service members, and if they had a concussion from an IED blast or a fall, they went straight to the medic. They gave them a big dose of NAC to make glutathione to quench inflammation. And after a week, 42% of the service members who didn't have any NAC recovered, but 82% of those who took NAC recovered fully from their concussion.
Wow, that's a pretty good human trial then.
Yeah, it really works. Also in the kit, I recommend vitamin D, 10,000 international units. And we know that people, if they are deficient in vitamin D, that they are more likely to suffer the post-concussive syndrome, the long-term problems related to a concussion. Curcumin, we love curcumin, 1,000 milligrams of curcumin to, again, decrease inflammation. In particular, curcumin helps with that swelling, because if there's a concussion, there's nowhere for the brain to go if there's swelling.
Well, wait, let's go a little bit more deeply into curcumin. Mm-hmm. What's another word that people may recognize if they're not familiar with that active constituent?
Good point. Turmeric. And so curcumin is the active ingredient found in the spice turmeric. It's in yellow curry, and it's, there's different forms of it out there. It can be found in 500 milligram capsules. You want, of course, high quality, and combined with black pepper, it is better absorbed. Biopterin is another name for the black pepper. And also there's a phospholipid version where they'll combine it manufacturer called Longvita has bound it to a phospholipid, and studies show that it does get into the brain in this way. And it's likely that other versions of the phospholipid, curcumin, where it's kind of bound to that molecule, get into the brain as well.
Well, that's a great protocol right there. And we're going to take a little break. And we're speaking today with Dr. Kapran Chapik. And just want to tell you that you are listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. Listen live online at nccradio.org or on iHeartRadio. For more information on today's guest or topic, email us at whpc@ncc.edu. Stay tuned. Herbally Yours will be right back.
Adopt US Kids presents What to Expect When You're Expecting a Teenager. Learning the lingo.
Jelly. Jelly adjective. Jelly is a shorter, better way to say jealous. As in, Chloe, I am like so jelly of your unicorn phone case.
You don't have to speak teen to be a perfect parent. Thousands of teens in foster care will love you just the same. Visit adoptuskids.org, brought to you by the U.S. Department of Health and Human Services, Adopt U.S. Kids, and the Ad Council.
My mother was very familiar with her neighborhood, but one day she stopped at the stop sign, and she wasn't even really sure where she was at.
When something feels different, it could be Alzheimer's. Now is the time to talk. A message from the Alzheimer's Association and the Ad Council.
And welcome back. Two more right here on Herbally Yours. Thank you so much for joining us right here on the voice of Nassau Community College, 90.3 WHPC. And you can always find me, Natural Nurse, at naturalnurse.com. And today our guest is Dr. Kapran Chapik, and he is a staff physician at the Amen Clinics. Now we see Dr. Amen. He is like very busy on PBS.
Mm-hmm.
He's doing a lot of shows talking also about health and wellness of the brain. So he's very fortunate to have you as part of the staff there with your in-depth expertise as a naturopathic physician, and in particular, the founding president of the Psychiatric Association of Naturopathic Physicians. So we're talking psychiatric here as well as physical brain injury. How do those two things intersect?
Love that question, because a lot of times people have a mental health issue, in fact, and they don't realize it's due to a past brain injury. So we did an informal study and looked at that question. So how many people come to the Amen clinics where we do a type of brain imaging looking at blood flow and activity, and found that 4 out of 10 people who come to Amen clinics for some other reason actually have had a brain injury sometime in the past, from mild concussion to more severe brain injury, and that it's probably contributing to their mental health issues, depression, anxiety, anger, and it's staggering. I can tell you a quick story.
Well, yeah, I mean, also, how would someone not know that they had a brain injury?
You know, it's a great question. This is what continues to stagger me. And I think it's because, Ellen, that people, and myself included, we minimize a concussion. You hit your head, everything's fine. Most times, if you haven't gone to the emergency room, maybe it wasn't a concussion. If you weren't diagnosed, maybe it wasn't a concussion. Or if you didn't lose consciousness, it wasn't. But actually, it could have been a concussion. You don't have to lose consciousness to have a concussion or a head injury.
So you're saying there's a lot of under-diagnostics, and something may have happened when someone was playing sports in high school, and, you know, who remembers that when you're 30 years old?
You've got it. Exactly. And we know that simply playing football and repeated hits to the head can contribute to and actually change the brain. And that's what
that's getting a lot of press. You're right. But how about things like soccer?
Oh my goodness. They've changed the rules of soccer that they don't allow kids to head the ball anymore until they're age 11.
No, I didn't know that. My son played soccer, the one whose wife went to Bastille, so they're 45 now, so it was a long time ago.
Oh.
So I didn't hear about that change in rules.
Yeah, I was very happy in that, it's probably should change the rules even further, but just they know the brain is developing, and girls are even more susceptible to the effect of hitting the head and having concussions. The female brain.
So any
more
kind of
susceptible.
sports, really, you may have had brain injury, even though it is sort of underdiagnosed, underreported, and may, in fact, be one of the causative factors that are leading to, something that may be considered a mental health issue.
Precisely. And it could have been a car accident. Whiplash, if it's enough impact to damage the muscles of the neck, it could be enough to jostle the brain, because the brain is so soft. It's as soft as butter. And the skull is so hard. It's floating in this skull that is as hard as rock. And it's got many bony ridges that are sharp. It can damage the brain. And so simply a strong acceleration, deceleration force, shaking the brain, sort of like shaken baby syndrome. I hate to bring up that analogy because it's so sad, but it's true. If you jostle or shake the brain very vigorously, that can cause damage.
So how would somebody, find out, in fact, that was part of the issue? Are there certain tests that you do at the clinic and that other doctors might do where they're looking to see if there was a past brain injury or not?
Yeah, so we do at Amen Clinic SPECT imaging, which stands for SPECT, and it's a type of blood flow study. We're looking at activity, and it's very sensitive at picking up mild traumatic brain injury, which is different than an MRI or CT scan, which is not very good at picking up brain injury patterns unless it's more severe. And so that's probably the best way to find out if you've ever had a brain injury.
Wait, what is the name of that test?
SPECT, so it stands for Single Photon Emission Computed Tomography.
So that isn't widely available, I imagine.
It's not. Most hospitals do SPECT studies, and they've been doing SPECT studies for 50 years on heart and different organs, including the brain. And it's similar to PET. So PET you may have heard of they'll often do for Alzheimer's, and that's a blood flow study also. So it's like that. It's a blood flow study, and we have 8 clinics around the country that 4 on the West Coast, 3 on the East Coast, and Chicago. And so people can actually come in and scan their brain and understand how it's working and if there's been injury. But if you can't come in and do a brain scan, and this is part of our assessment, is to try and ask people 10 times if they've ever had a brain injury. And when I started working at Amen Clinics, I was just so surprised that it's true. Like if you ask someone, have you ever played contact sports? Have you ever had a motor vehicle accident? Have you ever fallen out of a tree? And if you ask specifically, or if you think back in your life, if you think back specifically, you think, yes, I did fall out of a tree when I was 10 years old. I forgot about that. Maybe that was a head injury. Maybe that was a brain injury.
So I'd like to remind you, listeners, that you are listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. I'm Ellen Kamai, the natural nurse. And my guest today is Dr. Kapran Chapik, and he is talking about his upcoming book. There's a lot of information we're talking about on the show today that is in his new book called Concussion Rescue. Integrative therapies for head injuries, but also dementia, PTSD, and anxiety disorders. That's the interesting part, because so many people suffer from anxiety, and many clients that I have had also, and I don't think we've ever discussed past head injuries as being related to the anxiety.
Mm-hmm. It can be. In fact, there's some evidence that OCD can be caused by a past brain injury. I had a patient who was I saw him when he was in his 40s, but he had a fall off of the playground when he was 8 or 9, and shortly thereafter started washing his hands obsessively, had these intrusive thoughts that were bothering him, and had OCD from that age on until we were able to treat his brain injury.
So it's really great. People must be so happy when you sort of dig deeper and get down to sort of the root of an issue.
Absolutely. That's what I love to do as a naturopathic physician, is to try and find the cause of people's problems. And this is just one thing I want people to know about, because there's so many people suffering with a brain injury, walking around with either depression, anxiety, anger problems, and it's not getting better. And to think about, it could be a past brain injury. And then there's a lot of people who have had a concussion and they're not getting better. They're continuing to struggle for months and sometimes years. It's really sad. You did give us a nice list of supplements, and we only have a few minutes left. But besides supplements, what are some of the other therapeutic interventions that you use? Yeah, so nutrition, eating what you eat, can actually really help heal a concussion or a brain injury. And what seems to be the best is a ketogenic diet, or at least a low carbohydrate diet. Because after an injury, the machinery, the glucose processing machinery in the brain, this very hungry brain uses 20 to 30% of the calories in the diet. That part is broken. It's not working as well. And so there's this deficit. Ketones, or a ketogenic diet, should be tried as a therapeutic tool, because a ketogenic diet is a high-fat, very low carbohydrate diet where the body shifts to using fats for fuel. And these ketone bodies get right into the brain. They can be used for energy and can help with healing. They're anti-inflammatory, and it's an alternative fuel source for the brain.
So that's something people can check into as well. So I want to thank you so much for being our guest, Dr. Kapran Chapek. Tell people a little bit more about just the Amen Clinic and where they can find your book.
Thanks. So I work at the Seattle Amen Clinics, and Dr. Amen's been doing this work for 30 years. His big idea was to look at the brain as well as talk to people. He's a psychiatrist. And we use talking and history as well as imaging to create comprehensive treatment plans for people. And so as a naturopathic physician, that's what I love to do. I've been there for the past 7 years and been working in brain health, mental health for the past 12. They can find my new book, which will be coming out January 28th. You can pre-order now on Amazon or wherever books are sold. And we're at amenclinics.com.
Well, thank you so much for being my guest today. And thank you, listeners, for joining us once again for another edition of Herbally Yours, right here, produced in the studios of 90.3 WHPC, Nassau Community College, Garden City, New York. For further information, email us at whpc@ncc.edu. This is your host, Ellen Kamai, the Natural Nurse, at naturalnurse.com, inviting you to join us next week for another edition of Herbally Yours. Until then, stay healthy.